First, I want to thank again all of you for attending today. Really great to have a turnout for this event, especially in our first year. So I really appreciate all of you being here. Um, what I want to do today, I called this a workshop because I really want to take this opportunity to start a conversation and to really, as Dr. Johns started in his keynote, get us to start thinking about the areas that we're stuck. And as individuals, and then transferring that to our organizations, look at how we can start to get our feet out of that muck and start to move forward in a different direction. I think it's really important to realize, as I said, I was personally introduced to Dr. John about 6 months ago. I'm currently finishing up his Thriving Workplace Culture certification, which for any of you that this intrigues you, I strongly encourage you to do that. For me, as he said, what I found when I first encountered his work was that I felt uncomfortable. I realized that there were things that I was doing that were working very well because for those of you who don't know about WellTrail, we place healthcare professionals into workplaces. They work individually with the employees. So we aren't program based, we aren't screening based, we aren't incentive based. It is entirely based on that model of intrinsic coaching and helping people to recognize what they want to do, but then provide them the support and the resources to do so. So there were a lot of things that I in this community felt that we were doing really well, and we've been working to bring more of that out. But as I started to really listen to Dr. John around the areas of culture and organizational leadership, and even some of the ways that we use some of the standards of wellness in terms of our screenings and things, I said, you know, if I'm going to not only grow my own business, but really help more people and help this community, I need to challenge myself. And that means stepping outside of what you're comfortable with and being prepared to admit that you were wrong on things. And there have been things where I've said, wow, I need to really look at something differently. And then there have been other pieces that have been really reinforced. So my goal today in the short amount of time that I have is to really get all of you to that point of discomfort. So if you want to get up and leave because you don't want to be uncomfortable, I'm fine with that. But that really is my goal. In the beginning, I'm going to try to get a little bit of interaction and try to blend that in as we go too, because I don't want this to be about me standing up here and telling you what you need to do, because I don't know. I don't know that for you as an individual. I don't know that for your organization. And quite frankly, you know what's good for you, but you also don't know what's good for each individual at your organization. So if we start by looking at ourselves, we'll be able to then work better with other people. And that's what today is about, really about starting that conversation. Really quickly, for those of you who don't know my background, yes, I'm the president and founder of WellTrail, but I started my career, if you will, as a licensed athletic trainer up at Syracuse University. I was there for 8 years. I started the year Donovan McNabb started. I left the year Carmelo left, and we won our national championship, and I got the heck out of Dodge. And I said, you know, it's probably not going to get much better than this. But my experience there as an athletic trainer was amazing because you're working with such a variety of individuals, all with different goals, all with different skill levels, all with different backgrounds, all with different health issues. Even though we don't think of athletes as having health issues, there were plenty. The things that we were exposed to there ranged from one end of the extreme to the other. And of course, woven throughout that were all of the personal issues, boyfriend problems, girlfriend problems, I'm failing a class, I can't get home for the holidays. All these things that affected them also affected their performance and affected their health. And so when I crossed over into the workplace space, I brought that training as an athletic trainer with all of the competencies that we have to pass in order to be licensed. But I also brought that component of working with an individual. And so that's what I'm hoping we'll be able to talk about today. So really supporting employee health through the 3 C's. And the 3 C's are your culture, your climate, and your choice, or your choices, what you offer. Certainly Dr. John has already talked quite a bit about culture, and I'm not going to stand up here and pretend to be an expert on culture by any means. I'm learning it as I go along as well. But that is something that we're going to talk about, the importance of making sure that that's woven throughout everything that you do. What I want to do, though, today is just start off the conversation with a question, and this is where I definitely need some interaction back. Who can tell me a definition of health? What is health in your definition? Anybody? Yep. Okay, so, and we hear that a lot. So absence of disease, especially in the medical community, we'll hear that. Anybody have anything to add to that?
I find that for me, health is a balance of the aspects of life, work, family,
Okay. Perfect. So, and you both pick on the perfect thing. So yeah, if we look at what the actual definitions of health are, if you go to the Webster Dictionary, the condition of being in sound body, mind, or spirit, which is great that they have all those components in there, but you'll notice it then puts down freedom or absence from physical disease. So it seems to always come back to that physical component, but at least we're looking at mind, body, spirit as well. Now, a little more advanced is who? The World Health Organization. They have definitely expanded their definition of health to state that health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. So we're moving forward. And I think that the most important thing to remember is that this is talking in generalities, right? But when we're talking about health, we are talking about individuals. And yet, somehow in the world of wellness, we always stay focused on population health. What population? What is the population made up of? Individuals. So, where is the relevance of population health over individual health? So, my challenge to you is to continue to define what health means to you and what health means to your organization. I'm going to do something a little different here, so hopefully this plays out the way I want it to. Um, I need your feedback on this because what we're going to do is we're going to make a list, okay? And for right now, I want you to keep your traditional wellness hat on. I know we've already been exposed a lot by what Dr. Robeson talked about today. Keeping in that traditional wellness mindset, okay, whether you are the wellness vendor, whether you are the HR, let's talk a little bit about how we traditionally have been measuring employee health. So I'm going to knock out of the show for a minute. And we're just going to enter this in as we go. So you guys can just shout stuff out to me. I'll be your scrivener up here. What do we use to measure our workplace wellness programs? What do we want to see back when we get our reports? What are we typically looking at or wonder what is a like what about biometrics? Improvements. Okay, so improvements in biometrics. What else? Sorry if I typo. Okay, so participation. What else? Okay, so cost utilization. Okay, sure. Sick days, absenteeism. I'm going to just type in the big one, of course, presenteeism, because we can measure that. What else? Okay. I'm seeing you're jumping out of this box, but I'm going to put it because thank goodness you're already straddling that. So that's perfect. What else? There's a couple big ones. What was that? Sure, yes, absolutely, right? Because of course that's the problem is that everybody just needs to change their behaviors. What else? Thank you. That was the big one I was waiting for. So cost savings, ROI, right? We missing any big ones there? Productivity, maybe. I'll put that in. Okay. Can you guys see that color? We'll change the color just for. Okay, so that's generally speaking what we're going to see in traditional workplace wellness, right? That's what we're measuring. If you have a vendor or your insurance company is giving you reports at the end of the year based on it, this is typically the stuff that you're going to see there, right? All right. So we all agree that's what's happening right now. What I want to do though now is let's go to what I believe you brought up. Let's talk about what your health means to you. Okay? How do you measure your own health? What determines in your mind you go home at the end of the day and go, man, I feel good today. I feel healthy. And don't think about what we think that it should be. I want you to tell me what really is your measurement for yourself. Okay? So anybody, what's one for you? Purpose. Okay. Love it. Just shout these out at me. Yes. Energy, happiness, motivation. In what way? So you're driven on your own. Okay. We'll put that important, all important word intrinsic in there then. What else? Thank you. Okay, so I'm even going to put confident with that because that's almost a confidence in my ability. Confident, capable, right? And capable. What else? Oh, love it. Sorry, there was a big old typo there. That's why I need somebody else to do my typing. What else? Oh, rested, right? Rested, refreshed, recharged. What else? Mm, very good. Oops, let me go back. Ownership. What was the word? I'm blanking on it. Autonomy, right? It's painful to watch me type, isn't it? Yes, Nancy. What was that? Family? Okay. Family. Family health? Okay, yeah, yeah. Okay, so family well-being. Perfect. Pro- was that productive? Yep. Okay. Productive in what? Okay. 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 So productive towards your own goals. Okay, fantastic. So again, I'm going to, sorry for my bad typing here. I'm going to go ahead and highlight these. Take a look at this list that we just did. Okay. I'm going to go ahead and I promise I won't keep playing with the machine up here after this, but I want to copy. I want to show you what we just did. So here's what's important to us. Here is what we're telling other people should be important. It's coming. Okay, take a look at this. I'm going to go back to slideshow here. Okay. Does this make sense? What makes anybody that we are working with any different than us? I don't know if there's a laser pointer on this or not. Why on earth do we think that we can measure everybody's other else's health by the number of days that they take off, by the cost that they're costing us, which we don't actually even know, to be honest. As we said, so many of these cost studies have been so flawed, it's ridiculous. Whether or not they're engaging in things or participating in things that we're telling them to do that may or may not meet their needs. Why on earth, as companies, as vendors, as healthcare professionals, are we constantly trying to fit everybody else into a mold that is not the mold that we have for ourselves? The list you just gave me for your own health goals, isn't that what everybody in here wants? I didn't see anybody in here when we said, "Oh, I want to feel autonomous." Go, "God, no. I don't want autonomy. I don't want energy. Dang it, you kidding me? You want my family to be healthy? Heck no." So why on earth do we not give other people credit for thinking that those are the things that are important to them too? If we go back to that definition of health, the only definition of health that matters is the individual that you are working with at that moment. The only definition of health that matters to you is your own. Mine is different than yours. Yours is different from hers. Everybody's in this room is going to have a little variation because there are things in your world that are different. And probably more importantly, your definition of health is going to shift as you go through your life. Before the age of 40, I had a hip replacement. I thought I would never run again. I couldn't ride a bike. I couldn't push a grocery cart in Wegmans for 5 years before that happened. Do you know what my definition of health at that point would have been? And I'm sorry if I get emotional. It would have been, my God, let me go ride a bike with my daughter. That's health. That's what's important. That's what drives people. That's what motivated me every day to keep pushing to find an answer, to get myself back to what was important. Nobody told me that wasn't important. Well, I shouldn't say that. There were people who told me that wasn't important. There were people who told me, just be happy you're walking. Just be happy. You're going to get a hip. And then in 10 years, you'll get another one. And in 10 years, you'll get another one. I can do more on this hip now than I could on my real hip. It's your definition of health that matters. We need to allow people that autonomy, that capability, that trust, that they know what's important to them. And then our job as clinicians, as HR folks, as builders of these organizations, is to start to find ways to support that. That's the goal that we all need to look to. So I'm going to go way, way, way out on a limb, and I really need somebody willing to participate with me here, okay? I know we're talking about health and wellness today, but I think we get into these thought bubbles when we talk about health and wellness, right? So we talk about workplace health, it's boom, 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 boom. And this is how we get there boom, 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 boom. And this is what we're going to measure boom, 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 boom. So I want to take health off the table. I want to talk something else about something else we have to deal with every day. So we're going to talk about household chores, okay? How many of you have a chore that you absolutely hate, despise? You would rather, okay, thank you. Right, most of us. We all have that. So let's just go around the room. Who put your hands back up for those people who feel really strongly. Tell me what yours is. Oh, I hate that one. Okay. Vacuum. Folding laundry. We need to get all of you together and you can have like a little assembly line. Maureen. Don't they have companies that do that for us? I know, right? Yes. Oh, that's one of my favorites, actually. Anybody else over here have a strong one? Yeah. Catching mice. Cat. I know where to find some cats for you. So just starting off with that, interesting, isn't it? Not two people said the same thing. Okay? How many chores are there out there? I mean, hundreds at least, right? Okay. So here's what we're going to do. I want you to think about, and I'm trying to think, who told me cleaning the refrigerator? Because that one's really, I'm going to pick on you. Just because that's so unique. I love it. So we're going to talk a little bit about the chore that you hate the most. Okay, we're going to have a little coaching conversation right here. And it's going to be a little less coaching because I'm going to throw the questions up here so you guys see what I'm doing too. But what we're going to do is we're going to uncover why she despises cleaning the refrigerator so much. But more importantly, let's find out what she'd rather be doing. What else can she do? So we're going to start with a pretty simple question, which is, why is it important to clean your refrigerator? There's no right or wrong answer. Just saying.
Uh, so you run out of Tupperware containers.
Oh, so too many Tupperware containers. Now you can no longer make more things to put into the Tupperware to put into the fridge. Okay. All right. So lack of Tupperware. What else? Okay. Okay. So the food itself needing to, is it past its due date, that kind of thing. Okay. Is there anything else? Okay. Okay, out with the old, in with the new. Okay, so those are the reasons that are important to you. Now, I'm not going to ask anybody else to chime in, but I want you to be thinking, whether it's about the chore that you hate as I'm asking these questions, answer them for yourself, or, and I'm sorry, what's your name? Oh, perfect. Easy. So as Kelly's talking, you can also think about what other things maybe are coming into your mind. So you might have had some answers when I asked that, why is it important? Some of you are like, oh my God, I know, it's this, right? And you're just wanting to jump out of your seats and fill in her answers. Pay attention to that, okay? So, Kelly, who else has told you it's important? Where does this come from? Why do you know to do this? Who says it's important to clean it? You? Where'd you learn that from? Okay, your mom. Where do you think your mom learned it from? Yeah, okay. So it probably goes, so you didn't take a class that says you need to clean out your Tupperware every time or else you're going to run out of money because you're just buying new Tupperware. So it's been passed down. Monkeys on ladders, hose waiting. That fear factor. Tell me, what's going to happen if you don't? What would happen if you didn't clean out your refrigerator? Like what? Spoiled food. Okay. People not wanting to eat the spoiled food. Okay. All right. Okay. And what was the outcome of that? So that leads me perfect. Thank you. You segued me perfectly. So what actually happens when you don't? No one else does it. Okay. Interesting. And so if you just continue not to do it, all those things that you fear would happen, correct? In theory. Okay. All right. What are the alternatives to you doing it? Okay, you can assign the task to somebody else. You could choose not to do it. You could just let it happen and let the chips fall. Okay, so you could assign somebody, could do that. Any other options pop to your mind? No matter how ludicrous they seem. You could eat takeout every night. See, the point is, though, there are options, aren't there? There are always choices. Doesn't mean they're right, but there's always choices. So if you consider the wealth or the health, well being, safety of your household, how important is this? Give me a scale of 1 to 10. 10 is like, oh my gosh, the house is going to fall down and everybody in it's going to die if I don't clean the refrigerator. In the scheme of your world, a 6. So that's pretty high on the list. Okay. All right. What things are more important in the health, well-being state? Just name a few that right off the top of your head, like this is really important. Laundry. Okay. Don't ask any of these folks to help you. Okay. What else? Shopping. So shopping for the food. Okay. And again, as you guys are thinking, there's probably a million things that jump out to each of you. What's important in keeping my household running? What's important in keeping my family healthy? And there's probably a million other things you have too. All right. How do you feel when you're cleaning that refrigerator? That you guys couldn't see her look. She's like, are you like sitting there mumbling things under your breath or yeah, okay. So it's when you're forced to do something you don't want to. It's not like you get in there and you're like, "Oh, I have to do this. So therefore I'm going to just make this fun," right? It's torture. Okay. And how well do you actually do it? I mean, do you kind of half it or are you like, "Okay, I'm in here. I'm just going to do the whole thing." Pretty thorough. Okay. All right. Important to understand that. So that answered that question. List 3 things during that amount of time that it takes you to clean the fridge that you would rather be doing during that time that would also be contributing to health, safety, well-being, whatever. Throw out 3 that just jump to your mind, like that maybe you don't have time to do otherwise, but you might substitute the time in. Okay. Reorganize closets. Okay. Okay. Clean basement. You're all about these chores. We're gonna get a group together to help you. So here's the thing. Now talking to everybody else. Okay. Again, something really simple, something really basic. Not a whole lot of threat around talking about cleaning a refrigerator, right? But watch what you did as I asked her the questions. How many of you, when I asked her why it was important, immediately had your own reasons? Okay, at least a few people, or you were thinking something in your head. Not necessarily that was more important, but something came up to you. How many of you were kind of secretly sitting there giggling and laughing, going, God, I'm so glad she didn't call on me and I don't have to do this? Right? Who wanted to give her answers? Or at least thought of answers that would work for her. That if you were sitting in a private conversation with her, would have said, well, wait a minute. Don't you know you could do this? You could do this. You could do this. That's human nature, to take our own reflections, our own experience, our own ideas, our own monkeys on the ladder, and put them on everybody else. And we're just talking about a chore. Sue's happy because I was going to call on her and make her tell me that she hated cleaning toilets. So I was glad I got one I could segue off of too. Because I was afraid everybody was say like mowing their lawn. I was like, oh, I can't make that bad. So what I'm challenging you to do is watch your own reactions. If we are helping our organization to build a culture, a thriving workplace culture, if we are helping our organizations to support employee well-being, we have to do it at the individual level. But in doing so, we have to remove our own individual biases from it. Your answers are not their answers. The CEO's idea of health is not the idea of health of the person working on the line, or the secretary, or the lawyer, or the doctor. It is not the same. Your manager's idea of health is not the same as yours. And if you are a manager, your idea of health is not the same as the folks that are reporting to you. We have to keep that front of mind in order to support and engage and recruit involvement in people's own autonomous goals towards health. It is the only way that this works. So, as you move forward, consider what questions can I ask to understand the person I'm trying to help or the people I'm trying to help. Because not everybody's going to have the opportunity to go out and sit down for 30 minutes with every single employee. But how do we start to ask these questions and get some answers to better understand the circumstances of the other people around us instead of trying to place our own circumstances onto them? It's all about starting a new conversation. None of us have any idea what it's like to be in anybody else's shoes. We can empathize, we can sympathize, we might have some similar experiences. If anybody else in here has a hip replacement, absolutely, we're kindred spirits. There's going to be things that we've both experienced that other people haven't experienced, but I guarantee my experience is different than yours. Okay. After this word from your public sponsor. Who are we to decide what other people are going to do? So again, isn't it time that we start asking the questions? Assume people are capable. Just as Dr. John said, if we treat people as capable and competent and intelligent, they will meet us there. When you treat people as anything less, they will meet you there. How many of you have kids? Okay. How well does it work to talk down to your kids? What do? Or even a spouse probably, right? They dig in their heels. Doesn't matter if they think you're right or not. It doesn't matter if they would have done it on their own or not. The second you make them feel less than, they shut down. Autonomy is gone. Their intrinsic motivation is gone. It is especially important to consider that in health because I don't think there's anything more personal to us than our health and well-being. So it's important to make sure that we trust each other and we trust the people that we are trying to help, that they know what's best for them. They know what is important to them. So there's thousands of chores that you could do. There's no time to do all of them. There's no need to do all of them. No matter what the chore is, you can pay somebody else to do it. You can delegate it to somebody else. You could not do it at all. You can find an alternative. You could just eat out for the rest of your life. The point is there are choices. There are different ways to get to the same goal. Some of them will fit. Some of them won't fit. But those are the questions that have to be brought up. We cannot just assume that the answer to not cleaning your refrigerator is you're going to assign it to your child, who probably won't. They'll probably take all the Tupperware with the food in it, throw it out, and now you're back at square one and just have more problems. You cannot assume that your answer is the right answer for everybody else. So you at least need to help people come to the conclusion of what options are out there and then let them try them on and fit. To me, healthcare, medicine, coaching, it is all one big experiment. Health is a big experiment. You need the knowledge. You need to know the basis. You need to know the science. But we were having a conversation last night. My team is athletic trainers and exercise physiologists, and we had Dr. John with us with all of his background. And we were talking about how in athletic training, you study all of these books, and you literally are tested in, Laura, correct me, 15 proficiencies, something like that, that we have to sit for an all-day test and license. But you know what else we're required to do? 1,500 hours of service, doing the work, working with people, not just sitting there taping ankles. You got to go out and work with people. You have to run rehabs. You have to learn how to deal with people. Why is it any different in health and wellness? I can go out and read a fitness magazine, doesn't mean it's going to fit. If I read my Arnheim book on ankle injuries, and you come to me with an ankle injury, I'll be lucky if 50% of what you display to me is in that book. Okay? Medicine is not perfect. It's not formula-based. Health is not perfect. It's not formula-based. So we have the science to support what can happen, why it happens, how the systems work. And now when we get to that person, though, we have to deal with that person as a whole. And yes, there are systems, but the systems do not line up in perfect formula. There are so many things that you have to take into account when you're dealing with an injury or an illness or a health concern. And those are the components that are most important to make sure that we are open to when we're developing our workplace health programs. So we talked about how you have all these other alternatives. If you don't want to do a chore, you either don't do it, you hire somebody to do it, you assign somebody else to do it, okay? We trust in ourselves, we trust in the people around us that the things are going to get done. If you don't clean the refrigerator, the house isn't going to fall down. Okay, really the biggest purpose of taking care of your house is that your house doesn't collapse on you, doesn't get eaten by mice, right? So somehow, has anybody had their house fall down in disrepair other than me, whose house was just literally demoed on Monday? I'm the bad person to be talking about this, totally not my fault though. Whole nother conversation. So, right? And how many of you do every chore that you think you should do? Do you? No, I'm kidding. I'm kidding. But there's probably even more things you could do, but you triage it, right? You do what has to get done. You do what you have time for. You do what you have resources for. And we trust ourselves in that. We trust that we are not going to let our house fall down. Why on earth do we treat people's health any differently than that? Do we really think that the majority of people, I'd even stress to any people, are going through their life just to try to give themselves bad health so they collapse? What stops people from making healthy choices? And I'm really putting that in quotes because I don't believe there is such a thing. Their circumstances. What are the things in front of them, perceived or real or otherwise? Do they know what their options are? Do they understand? Maybe they're doing things they don't have to do. Maybe they're doing things that aren't working towards their goal. The point is, why on earth do we treat health any differently? There are thousands of health investments we can make. You do not have to make every one. And every one is not right for you. It's about figuring out what fits you, what fits your goals, what do you want to accomplish. And the same holds true when we start to plan for an organizational health component. So how do we support individual health through the workplace programs? Again, I'm going to actually kind of skim over some of this because we've already talked about the culture piece. But the 3 C's: culture, climate, choice. As Dr. John put perfectly, there is no doubt that the culture is the piece that must be in place for any of this to be sustainable, for true transformation to happen. One of the things that I think is really important to consider too, and I'm not going to go into this because there's an entire session after the awards on this, but intrinsic motivation is key. We have been extrinsically motivating people to death, literally. It is frustrating. Is there a place for a motivator if you just want people to take a survey or you want them? Of course, but let's not call it what it isn't. It is not behavior change, nor do we need behavior change. It is not going to transform their health. It is not going to make your costs go down. It is not going to do any of these things that we think, if you go back to that box on the screen of what is workplace wellness supposed to do. It doesn't do any of that. And it certainly doesn't help anything in our personal box of health, does it? Me giving you an extrinsic motivator doesn't increase your energy, doesn't increase your rest, doesn't increase your confidence. If anything, it probably diminishes it because now you feel like I can't make this decision. You don't think I can do this unless you pay me to do it or unless you give me a kick in the hiney to do it, right? So I encourage you, if this is something that you felt stuck in, to go to the Dr. Robeson's breakout after the awards because he is going to talk about this. And I have to tell you, it is what got me hooked was the science behind this, because I do a lot of things very intuitively when I work with people, but I always go back and I back it with that science. And I'm like, I need to see this. And it is fascinating. Absolutely fascinating.